lecture is about the urinary system. We're going to start with some very basic anatomy. We will then pass on to the main pathologies and symptoms. We will at that point go through some of the questions a doctor should ask a patient. We will then focus on diagnostic tools and treatment options. But first, let's start with some anatomical recap. 2 kidneys, 2 ureters, 1 urinary bladder, and 1 urethra make up the urinary system. One of its many functions is to help the body get rid of waste materials, such as excess water, ammonia, urea, bilirubin, uric acid, and bacterial toxins. Urology also deals with the male reproductive tract. The male sex organs are the penis, which has a long tip called the glans penis, which supports the foreskin or prepuce, and the testes, also known as the testicles, which produce semen and sperm. The scrotum, the epididymis, and the vas deferens, which is also known as the sperm duct. The 3 accessory glands are the seminal vesicles, the prostate gland, and the bulbourethral glands. Now let's concentrate on the kidney. The ureter leaves the kidney through, and blood and lymphatic vessels enter and exit through the renal hilum. The renal hilum is the entrance to a cavity called the renal sinus. Within the kidney, there are 2 distinct regions, the cortex and the medulla. Within the medulla are cone-shaped pyramids. The portions that extend between renal pyramids are called the renal columns. Within the parenchyma are about 1 million nephrons. Urine formed by the nephrons drained into papillary ducts. They lead to cup-like structures called minor and major calyces. From the major calyces, the urine drains into a large cavity called the renal pelvis. Our next slide sums up the kidney's major roles. The kidney adjusts the composition and volume of the blood and remove wastes from it. The kidneys help regulate the blood pressure by secreting the enzyme renin, whose increases the blood pressure. The kidneys help synthesize the hormone calcitriol, the active form of vitamin D. The kidneys secrete the hormone that stimulates production of blood cells, named erythropoietin. During periods of fasting or starvation, they perform gluconeogenesis. Sometimes kidneys don't work properly or stop working completely. This is what we are going to see with our next slide. When both kidneys stop working entirely or almost entirely, we talk about acute renal failure. The main feature of acute renal failure is suppression of urine flow. The causes include low blood volume, decreased cardiac output, damages to the renal tubules, and kidney stones. When we refer to progressive decline in the glomerular filtration rate, we talk about chronic renal failure. Let's review a couple of other bladder and kidney conditions. Occasionally, the crystals of salt present in the urine may solidify into stones called renal calculi. A bacterial infection that affects any part of the urinary tract is named urinary tract infection. A condition characterized by excretion of large amounts of urine is called diabetes insipidus. These conditions are usually diagnosed thanks to a set of symptoms. Let's see what they are. Dysuria refers to painful urination. This is typically described to be a burning or stinging sensation. It's most often a result of urinary tract infection. Excessive or abnormally large production and or passage of urine is called polyuria. The symptom of painful, frequent urination of small volume is called strangury. Nocturia is the need to get up in the night to urinate, thus interrupting sleep. Its occurrence is more frequent in pregnant women and in the elderly. Incontinence is the lack of voluntary control over micturition. It may occur as a result of unconsciousness, injury to the spinal cord or spinal nerves, disease of the urinary bladder, or inability of the detrusor muscle to relax due to emotional stress. Hematuria is the presence of red blood cells in the urine. In front of these symptoms, let's review the questions a doctor should ask his or her patient. When receiving a patient complaining of urinary or kidney problems, these are the fields you should cover. General. How are your waterworks? Or what about your waterworks? Or, for an American patient, how is your plumbing? Frequency. Do you often need to pass water? Nocturia. Do you need to get up at night? Hematuria. Have you noticed any blood when passing water? Dysuria. Do you have any burning sensation when passing water? Retention. Do you have difficulty passing water? Hesitancy. Do you have difficulty starting to pee? Urgency. Do you feel an urge to pass water? Incontinence. Can you hold your water? Polyuria. Do you pass water more than usual? Polydipsia. Do you often feel thirsty? Abdominal pain. Do you have pains in your abdomen? Do you have pains in your tummy? Loin pain. Do you have any pain down your back? Fever. Do you have a fever? Discharge. Have you noticed any discharge? Weight loss. Have you lost weight recently? Now, let's review the most important steps of the physical exam. During the physical examination of the genitourinary tract, you should look for enlargement of the kidneys, enlargement of the bladder, disorders of the inguinal region, disorders of the genitalia, pelvic disease detectable by internal examination, like a digital rectal examination, neurological examination by testing reflexes in the genital area. On the next slide, we're going to review the most commonly used diagnostic tools. There are several screening tests that can provide information about kidney function. One is blood urea nitrogen. It measures nitrogen in the blood. When the GFR decreases severely, the burn rises. Another test is the measurement of plasma creatinine. Normally, the blood creatinine is steady. When its level rises, it's an indication of poor renal function. Even more useful is renal plasma clearance. We usually use creatinine, yet inulin gives an even more accurate determination of the GFR, as it is neither reabsorbed nor secreted at all. In case of BPH, benign prostatic hyperplasia, you may want to perform a digital rectal examination. In case of UTI, you can order or do an MSU, midstream urine. In urology and nephrology, there are also some blood tests that can be done, such as FBC, full blood count, urea and electrolytes, etc. Radiological investigations may include intravenous urogram of the kidney, ureter and bladder, ultrasound investigation of the renal tract, which is often used to distinguish between various sources of bleeding, X-rays that can be used to identify kidney stones, although CT scanning is more precise. In older patients, cystoscopy with biopsy of suspected lesions is often employed to investigate for bladder cancer. Again, there are various treatments that you can resort to depending on the condition. In case of kidney failure, you can resort to hemodialysis and kidney transplant. A penis pump for erectile dysfunction, pelvic floor electrical stimulation for an overactive bladder. In case of BPH or prostate cancer, you can perform a TURP or a laparoscopic radical prostatectomy. Thank you for your attention.